And welcome back. Well, while we're doing the happy dance for spring weather, many allergy sufferers are pulling out the tissues to deal with the sniffling, the sneezing, and the congestion.
And if this is you, you know how miserable it is. But did you know that 90%, 9 out of 10 people who suffer nasal congestion due to allergies also suffer from an anatomic blockage of their nose? Dr. Madan Kandula is here from Advent with more effective ways to address your allergies. Great to see you.
Great to be here.
So 9 out of 10 people,
Yep.
so people who have allergies and just think, oh, I have allergies,
Right.
they actually have something wrong with the anatomy of their nose
usually, yeah.
that's creating part of the problem.
Right. It's sort of, it just adds insult to injury. They play off of each other, but most folks, I'd say, you know, hardly anybody recognizes that those issues going on, so they try to treat the symptoms, and you usually fail treating those symptoms.
Well, yeah, this time of year, people are getting their allergy medicine out. Some are getting prescriptions. Is that the most common way that people treat their allergies?
Yeah, it is, absolutely. And it can be effective if, you know, if you're treating most of the issue, those meds can work. If you're treating 10% of the issue, those meds really can't work. And that's the hard part, is that's what most people face. You face an uphill battle. You're trying to attack it, you're trying to tackle it, but you know what you're trying to do to help the cause just isn't working.
Well, and they're using nasal decongestants, right? And that's where they think, well, why isn't it kicking in? Why aren't I breathing a little clearer? But if you have an anatomical blockage, the nasal decongestant is not going to do the trick. Is that the deal?
Correct. I mean, it can make a little bit of difference. If you've got nothing or something minimal, a little bit is something. So in the nose, a fraction of a millimeter goes a long way.
Really?
And, you know, really. And so meaning that so that helps. So again, and something's better than nothing, but it's really marginal compared to what it could be. But again, if that's the only tool you have, then you're going to kind of keep hammering away.
So there are a lot of people starting to feel allergies really kicking in. How do you determine then if somebody has just allergies or this insult to injury, if they actually have a problem with their anatomy?
Yep. So, you know, you got to look. I mean, so it's as simple as it sounds, but oftentimes most folks, if you really think about, you know, if you have allergy issues, you've gone to your doc, you know, what's been done to look at that. For us, the first step is just listening to the story, what's going on with somebody, and then looking. So we look in the nose, see what's going on. If we find any anatomic issues, we're going to point it out.
Is that invasive or just
no,
like
just looking. I mean, we look with a headlight. Sometimes we'll look with a small camera, but either way, we're just trying to figure out what's the lay of the land in there. So that's our baseline. If it looks like it's a primary anatomy issue, we're going to sort of look at that and maybe figure out if are there ways to move that forward. If it looks like it's primarily an allergy issue, we'll do allergy testing and figure out treatments there. So it really doesn't matter what somebody's issue is. If somebody has an issue, we can figure it out, and we can offer options, and we can offer solutions.
Well, what are some of the most common? Because I feel like everyone I know who has allergies say, oh, I have a deviated septum.
Right.
You know, that's what they always say. I have a deviated septum in my nose, and that's why I have allergies, right? Have you heard
and that's why they snore, too.
I know.
Right.
And I hear it from everyone who says they have really bad allergies. Is that the main cause?
No.
Or, okay, what are some of the big problems?
It's a very common. So a deviated septum, all that means is your midline of your nose, if it is bent, you've got a deviated septum.
Okay.
But really the main player for most folks who have allergy issues are things called turbinates. Turbinates are humidifiers in the nose that sit next to the septum, so they sort of play with each other or play off of each other. And so if somebody's feeling stuffy, the turbinates swell up and shut things down. If somebody's got chronic issues, the turbinates are almost always chronically enlarged, and so that's an underlying issue. So you know,
so it's almost like swelling up there,
it's swelling.
blockage.
If you've ever had a stuffy nose, you know what it feels like to have your turbinates enlarged.
Yeah, it's horrible.
It's horrible. And if you have that, if you feel like, for folks who have allergies that are of significance, they feel like that 24/7, especially in allergy season, which is miserable.
All right, give us the good news, because one of the things that's wonderful is that a lot of the treatments that you do are really have come so far, and people don't have to go to the hospital to have these
quick
treatments, even if the problem is with their anatomy.
Yeah, absolutely. So most folks who have anatomic issues we can treat in the office nowadays, which is a different statement than what I would have said 5 years ago, which is pretty remarkable, but that's the truth. So the most common thing we'll do for folks who have nasal blockage is reducing the turbinates. That's a simple 10-minute office procedure. You head out on your own, you can blow your nose, you do what you normally do. There's not really any big back end, which is great, and it really gets you all those millimeters that you're kind of searching for that way. So that's simple. We can do really simple in-office sinus procedures, just using a balloon to open the sinus areas up. We can't really take care of a septum in the office, but we can work around it. Most folks who have deviated septums, we can work around those septums. If we need to take care of that issue, we can certainly do that too. too with surgery.
Okay. So then if you do some of these procedures, will it eliminate your allergies?
No, it will not. So procedurally, anatomy gets you more room.
Yeah.
More room is good. So the more wiggle room you have, the more you can kind of withstand from an allergy front. So if the allergies are coming in, you got more wiggle room. It tends not to be as annoying. So most folks who end up going through in-office procedures and have allergy issues find that, you know, the allergies aren't gone, but it's a whole lot better to breathe easier.
Well, and that gets to a point, do you see it, doctor, as being a medical issue or as a quality of life issue? Because let me tell you, suffering with allergies, which I've done since before I was in high school, is not fun.
No, my brother doesn't leave the couch during allergy
It's miserable,
season.
and it gets,
awful.
I mean, we talked about this before, because it gets minimized, but if you look at allergy issues and nose and sinus issues, their impact on quality of life is a lot higher than things that get a whole lot more attention. So diabetes and heart disease and all those sorts of things. Those things are bad, but, you know, when you can't breathe and you're miserable, you know, that definitely impacts a lot of things, both just day-to-day life, your work productivity, just anything and everything that it can affect, it will do that.
So quality of life and a medical issue.
Both, absolutely.
Potentially.
Absolutely.
Yeah. I mean, you think about it, you just feel miserable. So stop feeling miserable.
Yeah.
Just stop it now. There's a free educational event. It's Breathe Well, treating allergies and nasal congestion. You can learn more about it at Advent. There's 2 times going on. Tuesday, the 26th, that's next Tuesday at 6 o'clock in Tosa. And then the following Wednesday at 6 o'clock will be in Mequon. That's where you can learn more about treating those allergies and nasal congestion. You can sign up and register at advent.md/event-form. That's where you can do that. Here are the locations, Tosa and Mequon. For Advent, it's advent.md.com for more information and phone number on your screen to make that appointment. Thanks for being here, doctor.
Thanks for having me.
Appreciate
Thank you.
your
Thank
time.
you.